Today we're here with Dr. Reynolds Delgado at the Texas Heart Institute. He's the Director of Cardiac Transplantation at the Texas Heart, and we're so happy to have him with us. Dr. Delgado, thank you for being with us today.
Well, thank you, Annie.
Now, we know that cardiac transplantation is something that seems so far removed from most people, but really so many people are in need of this great help. And can you tell us a little bit about how you evaluate a patient for transplant?
Yes. Well, first of all, there's a lot of people that need it, as you say. Around 6 million people in the United States have heart failure, and a good proportion of those need a transplant. The problem is we only have around 2,000 donors' hearts available to us in the nation per year. So we really have to focus on those patients who can get the most out of those 2,000 donors. And so really that's the focus when we're working somebody up for transplant, finding someone who's going to live a long, healthy life after the transplant.
Exactly. Now, there are several ways of helping the patient, right, with assist devices. Would you kind of mention those for us?
Yes, and you know, the transplants are a limited resource, so we only have that limited number that we can do per year. But there are other things we can do that are not. An example is the artificial heart devices. These are known as LVADs, or left ventricular assist devices. And these are small motors, small motor pumps that are tiny, about this big, that can be implanted with a surgery in the chest, underneath the heart, and they can pump blood for the heart. And so really in a failing heart, we have other alternatives like this.
We see that there's hope for people who can't even get a transplant, but they could come and be evaluated for even this assist device.
Absolutely, absolutely. There's so much we can do beyond transplant. And as for transplants, we do many of them. We did 57 in 2012. That's a lot of transplants. It's one a week. But one thing it's important for people of Houston to know is that herein, where we are standing and sitting, is the greatest med center in the world. Just right there, it's the greatest cancer hospital in the world, and here is the greatest cardiac hospital in the world. And within this med center, we can do just about anything that's doable in medicine.
That's excellent. Thank you, Dr. Delgado. We really appreciate you.
Thank you, Annie.